So when I arrive, this is where I check in. This is the waiting room. Restrooms in the back. And this is one of the waiting areas for the lab. That's where I'll go next. Okay, so I have a port in my chest, and she is sticking in a 1-inch needle. Let me win and I'll breathe in.
And deep breath in. 1, 2, 3. You okay?
Yes, it stings just for a minute when it goes in, and otherwise it's fine. So the first thing she's going to do is draw blood.
Well, just make sure I'm in the right spot.
And she's in the right spot.
And now I'm going to dress you up.
I probably didn't wear the best shirt for this today.
You're fine.
Wearing a V-neck that opens in the front is easier.
You're doing
Okay.
all right. Done deal. You can let go if you want.
Okay.
You don't have to.
Yeah.
All right.
All right. And then she's going to fill 2 vials with blood.
3.
Oh, 3.
I always thought that, and then I started reading this.
Works pretty slick.
For Compass Oncology, and it said, no chocolate.
Taking out the diluted blood.
Oh.
Here comes the good stuff.
I know, Bessie Raffles.
So I guess the first vial was diluted.
No, I was going to say that. I was like, who said that?
But I didn't see you put saline in.
That's why
I
I'm
did.
not
Oh, you
flushed
did?
it.
Oh, see, she's fast. I didn't even notice. She put saline in first. That's why it was
That's something
diluted.
new that I hear right now.
And then 2 vials of
You feeling okay?
full blood.
All right.
Ready to go?
And the great thing about this is by the time I see the doctor, he'll have some of the initial results of this blood work. It's quite a system here. And then in a couple of days on my chart will be all the other results of the blood.
These all will be done in just a couple minutes. I mean, within an hour.
Okay.
Yeah. You do them all here.
All right.
Another flush.
Yep. Now she flushes it. Then she'll cap it off and I'll be ready to go upstairs. Well, after I meet with the doctor, then I'll go upstairs to the infusion room. So this is the lab. And I thank you very much.
Oh, look at you got my nice sunflower in the background there. Gonna put your name on your tubes.
Okay. So this is Dr. William Winter, oncologist, surgeon, and absolutely awesome guitarist. And what I want to say about this man is that he has many, many patients, but he makes me feel like I am important to him. And that helps me heal emotionally and physically. And so I want to say thank you.
You're welcome. And you are...
Oh, we didn't get that on here.
Oh, here we go.
See, yeah, okay. And he hugged me when he came in. He's just incredibly awesome. So thank you. Oh, here comes the hug too. Oh, all right. Well, you missed that. I got the table, but okay. So that's Dr. Winter, and he is meeting with me before I go up to the infusion lab. So this is the infusion waiting room. Check in at the desk. Here's the waiting room. So this is the infusion room. It's like a big U. And on the counter coming in are books that you can take to read. And then I have brought in a basket of Avon. That looks a little blurry. And I've brought in some things for Scentsy pots and lipstick samples. And people make hats and bring in things. Give me just a second. And bring in things in. Patients can help themselves to any of this. It's just kind of a nice thing that we do, or that patients do. And and the other thing I wanted to say is way in the back is the pharmacy. They mix all the drugs here. And on the counter, if you can see the baskets, They've got several baskets here, and they fill them full of chips and nuts, and those are free to patients, as well as free coffee and tea, and they have a little fridge and water and ice. All free for patients. So she's wearing a cap on her head, and there's a machine here, and it sends cool air to her hair. And the hope is that you will keep your hair. Now for her, she tells me that it is not really working on keeping her hair, but hopefully then it will, when the hair comes in, it will be healthier hair than if she didn't do this at all. Thank you. So I wear booties and gloves, and there's an ice pack in the glove, and there's an ice pack on the top of the booty. You can see that it's kind of bulky. And that's my husband, thank you. And then there's an ice pack on the bottom too, a long one. And the theory is that the ice on your extremities decreases the size of the vessels, so the blood flow is less, which means less of the paclitaxel or the taxol gets into those areas, and therefore reduces the chances of your getting neuropathy, which is nerve pain or numbing. Now we've done this since the beginning, and I have had no nerve pain in my hands or my feet. Now the doctors tell me that this is not proven and it may or may not work. The nurses tell me it works most of the time, and it has worked for me so far, so we keep doing it because I am hopeful. Thanks for watching.
Thanks to Ryan.
So that took you through the procedures of when I go in for my infusion every 3 weeks. So I just had my 5th infusion, and I will have 6 altogether. So here's where I'm at. You know, when I took my chemo class, which I took before I started any of my chemo sessions, and it was just an introduction to chemo and what I might experience, I asked the question, does it get harder as time goes on, as you have more infusions? And the answer was yes. I didn't ask for clarification on that, and I wish I would have. Because here's where my misunderstanding was. When they said yes, I thought it meant that the week following my infusion would get worse. But it hasn't. I actually feel better after my 5th infusion than I did after my 4th. And I felt better after my 4th infusion than I did on my 3rd. My 1st infusion was indeed the worst the week following my 1st infusion. And my 2nd infusion was tough. Now, all of the infusions are hard on your body, and the week following your infusions, you don't feel good. But my palliative care doctor, my pain doctor, has made much of this more manageable by prescribing some medicines and doing some recommendations, and I shared what those were with you. So I'm on my 5th week, or I'm on my week after my 5th infusion, and although I do have some side effects, and I am very, very tired, and I have some tummy aches, other than that, this is a breeze compared to the others. What they were referring to that I didn't understand when I asked the question, does it get worse? Is when she answered yes, she was referring to that your body does get worse because these drugs take a toll on your organs. And this is why they won't let you have chemotherapy more than 6 treatments. Because then you are causing more damage to your body than you are good. Now, the drugs I'm taking attack all new cell growth in the body. So they attack every organ, every system that has new cell growth. My blood pressure is going up. Thankfully, it's not too high, but it's still going up. My pulse races sometimes when I stand up. I literally could count my pulse just by feeling it in my head. I don't even have to touch my head. I can count my pulse. That's my heart racing. But my heart's okay. It's strong, thankfully. My muscle tone is weakening. I'm tired, really tired. This week, every day I have taken a nap and I have slept for 2.5 hours, and I still sleep at night. The biggest thing that I've noticed, aside from the really dry mouth, and I've talked about that, is that my glucose levels, my A1C levels are very high. 3 weeks ago, they shot up to 289 or 285. And we let that go. But this last week, they're up to 329. And we can't overlook that. Now, my doctor assures me this is not diet related. This is because of the chemo drugs. And they anticipated that this would happen. So I am now taking metformin, which is a diabetic drug. And hopefully my numbers will come down. I'll have them checked again next week. I have never been on a diabetic drug. I have never needed to be on one. I'm hopeful that all these meds that I'm taking will be on a short-term basis. I am told that 4 weeks following my last infusion, I will start to feel better. And each month I will notice improvement. But it can take many months for me to get my strength back and for my organs to heal. And that is if this has all been successful, which I'm choosing to believe it is until I'm told otherwise. So I'm trying to stay positive, but it's hard. Feeling tired and not having energy to do much of anything. I get these ideas like, oh, I'm going to go in and I'm going to fix dinner. And by the time I walk to the kitchen, I'm too tired to do anything. It's taken its toll on my body, but I don't have many of the bad side effects that some people experience when they go through chemo. For this type of cancer, I do not have any swelling in my abdomen or my lower legs, which is often a problem when you're sitting around more. I have no vaginal bleeding, no incontinence. Those are all issues that many women experience going through this type of treatment. And so there are blessings. I'm not as sick as I could be. So I'm going to count my blessings. Thank you to my followers, my friends, my family that have been so supportive. You keep my spirits up. And thanks for following me and for watching me and for sharing my videos. I hope they're helping you or a loved one or someone you know. Take care.